In the 19th century, a disease moved through cities with terrifying speed. A person could appear well in the morning, then be dangerously weakened by nightfall. The disease was cholera, a silent and swift killer. Today we know cholera is caused by the bacterium Vibrio cholerae, usually spread through food or water contaminated with human waste. But in the cities of the 1800s, that truth was not yet understood. And before cholera was controlled, it would expose one of the deepest failures of the industrial age. Disease was not only a medical problem. It was a problem of water, waste, housing, poverty, and public responsibility. Cholera did not create modern public health in one single moment, but the fight against it helped force a new idea into public life. The health of a city could no longer be left to chance. By the early 19th century, industrial cities were growing faster than their infrastructure could handle. Workers crowded into narrow streets and damp housing. Clean water was unreliable. Sewage collected in cesspits flowed through drains and polluted rivers and wells. In many places, drinking water could be contaminated by the same waste a growing city failed to remove. People knew these cities were unhealthy. What they did not yet understand was exactly why. For much of the century, many doctors and officials believed in the miasma theory. They thought diseases spread through foul air, bad smells, and poisonous vapors rising from filth. That theory was wrong about cholera's true method of transmission. But the reforms it encouraged were not meaningless. Cleaner streets, better drainage, and improved waste removal could still reduce the conditions that allowed contaminated water to spread disease. Even mistaken ideas sometimes moved society toward real improvement. Cholera had been known in parts of South Asia for centuries, especially around the Ganges Delta. But in the 19th century, it began moving across the world with new force. The first global cholera pandemic spread from Bengal beginning in 1817. By the early 1830s, cholera had reached Britain. The first major British epidemic came in 1831 and 1832. Another severe outbreak followed in 1848 and 1849. Across the country, tens of thousands died. The disease struck hardest in crowded and poorer districts, where unsafe water and poor sanitation made survival more difficult. Cholera revealed the hidden structure of industrial society. The people with the least power often faced the greatest danger. As fear spread, pressure grew for action. Reformers argued that disease was not simply private misfortune, it was a public failure. In 1848, Britain passed the Public Health Act. It was limited. It did not solve the crisis, but it marked an important shift. The state was beginning to accept a clearer role in protecting public health. The idea was still new, it was still contested, but cholera had made inaction harder to defend. Then came one of the most famous investigations in medical history. In 1854, a violent cholera outbreak struck Soho in London. Many still blamed bad air. But a physician named John Snow suspected something different. Snow believed cholera was spreading through contaminated water. He studied where the deaths occurred. He spoke with residents. He compared households, streets, and water sources. His evidence pointed toward a public pump on Broad Street. Snow was not simply treating patients. He was tracing a disease through evidence, geography, and daily life. After Snow presented his findings, local authorities agreed to remove the pump handle. The outbreak was already declining, and historians continued to discuss exactly how much that action changed the immediate course of events. But Snow's investigation became a landmark. It showed how mapping, records, and careful observation could reveal the path of disease. It helped lay the foundation for modern epidemiology. The lesson was larger than one pump. If contaminated water could carry cholera, then public health required more than doctors at bedsides. It required clean water. It required sewage systems. It required inspection, planning, and government responsibility. It required seeing the city itself as part of the disease environment. London would be forced to confront that reality again. By the late 1850s, the River Thames was heavily polluted with sewage. In the hot summer of 1858, the smell became unbearable. The crisis became known as the Great Stink. For years, disease had devastated poor neighborhoods. But when the stench reached the heart of government, action came faster. Engineer Joseph Bazalgette helped design a vast new sewer system for London. Realistic Victorian engineering visuals. A large brick tunnel construction site with workers. Unique scene. Grounded. It was shaped by the miasma beliefs of the time and by the political pressure created by the polluted Thames. But its effect was profound. Cleaner water and better sanitation helped make modern cities more livable. Cholera changed the way societies understood death. Officials gathered statistics. Reformers studied maps. Inspectors examined housing, drainage, water supplies, and urban conditions. Public health became a system of evidence. It was no longer enough to describe suffering. Governments were increasingly expected to measure it, trace it, and prevent it. Modern public health grew from that realization. It grew from sewers and clean water, from maps and mortality records, from inspectors, engineers, physicians, and reformers, from the idea that prevention could save more lives than treatment alone. Cholera did not disappear from the world. It remains a threat where clean water, sanitation, and stable health systems are absent. That is part of its lasting warning. Cholera is not only a disease of the past. It is a measure of whether a society protects the basic conditions of life. In the shadow of cholera, cities began to learn a lesson that still defines public health today. To protect people from disease, a society must first protect the world they live in.
If you found this documentary valuable, like the video and subscribe to Fault Lines of History for more stories about the turning points that changed civilization.